How to perform CPR like a pro. Subscribe for more videos. Cardiopulmonary resuscitation, CPR, is a life-saving technique that can be performed in emergency situations to help revive a person whose heart has stopped beating. CPR can help maintain blood flow to the heart and brain until more advanced medical help arrives. Here is a step-by-step guide on how to perform CPR like a pro. Before starting CPR, check if the person is responsive by tapping their shoulder and shouting, "Are you okay?" If the person does not respond, call for emergency medical services, EMS, immediately and get an automated external defibrillator, AED, if one is available. Position the person, lay the person down on their back on a flat and firm surface. Kneel down beside the person, with one hand placed on their forehead and the other hand on their chin to tilt their head back. Check for breathing, look, listen, and feel for signs of normal breathing. Normal breathing should be rhythmic and occur about once every 5 to 6 seconds. If the person is not breathing normally, proceed to the next step. Start chest compressions. Place the heel of one hand in the center of the person's chest, with the other hand on top of it. Keep your arms straight and your shoulders directly above your hands. Compress the chest about 2 inches, 5 centimeters, deep, and then release it. The compression to relaxation ratio should be 30 to 2. That is, 30 compressions followed by 2 breaths. Give rescue breaths. Tilt the person's head back slightly and lift their chin up with 2 fingers. Pinch their nose closed and seal your mouth over their mouth. Blow into their mouth for about 1 second to deliver 1 breath. Repeat this for the second breath. Repeat chest compressions and rescue breaths. Continue with cycles of chest compressions and rescue breaths until help arrives or the person starts breathing normally. Use an AED. If an AED is available, turn it on and follow the voice prompts. If it is indicated to do so, attach the AED pads to the person's chest and press the shock button. If the AED does not indicate a shock is required, continue with CPR. It is important to note that CPR can be physically exhausting, so it's best to perform CPR in cycles with another person or switch with someone else every 2 minutes. Some additional tips for performing CPR effectively. Make sure to perform chest compressions at the correct depth and rate. Use enough force to compress the chest, but be careful not to break the person's ribs. Keep the person's head and neck in a neutral position to maintain an open airway. Perform rescue breaths with a complete seal over the person's mouth to avoid leaking air. CPR is a valuable skill to have and can mean the difference between life and death in an emergency situation. It is important to keep your CPR skills up to date by taking a refresher course every 2 years. In conclusion, performing CPR like a pro requires the correct technique, practice, and confidence. If you witness a person in cardiac arrest, remember to stay calm, call for emergency medical services, and start CPR immediately. Every minute counts in these situations, and prompt CPR can greatly increase a person's chance of survival. Do not forget to subscribe for more new videos.